Hello guys, welcome all of you to today's PHARMCAST. Today we'll discuss 5 drugs of choice, one anti-cancer drug, and few questions asked by the students. Not few, actually there are many, right? And let us begin with the drugs of choice first of all. The first one is guys, empirical drug of choice for meningitis. It was asked few years back in AIMS exam. What is the empirical drug of choice for meningitis when you do not know the cause exactly? So think guys, what is the drug of choice? What do you think? Alright, I'll give you two options. Is it vancomycin or is it ceftriaxone? What do you think? Guys, here your answer would be ceftriaxone because meningitis is mostly caused by gram negatives like meningococcus, H influenza, right? And ceftriaxone has great activity. So empirical drug of choice when you do not know the cause, meningitis drug of choice is ceftriaxone. Second disorder for today, guys, mesothelioma. Now mesothelioma, if they ask you single drug of choice, it is undoubtedly, which drug is it? Think. It is an anti-folate drug. Which drug is it? No, it is not methotrexate. If you are thinking methotrexate, it is sister of methotrexate, that is pemetrexate, right? So pemetrexate is the drug of choice for mesothelioma. How do I make a regimen? I combine cisplatin or carboplatin with pemetrexate. So that is the standard regimen. Pemetrexate plus cisplatin or carboplatin, that is a platinum compound, plus minus bevacizumab. So bevacizumab can be combined in some patients who are candidate, and that is plus minus, right? So bevacizumab, which class of drug is it, guys? Bevacizumab, it inhibits what? Think, it inhibits VEGF, vascular endothelial growth factor, right? Third disorder for today, guys, methanol poisoning. Now it's an easy one, guys. It has been asked many times in our exams. Methanol poisoning drug of choice is fomepizole. How does it act? By inhibiting alcohol dehydrogenase. Comparatively, it would block metabolism of methanol into those toxic products, right? Fourth disorder for today, it is microsporidiosis. Microsporidiosis, guys, drug of choice is an antihelminthic drug. Now think, which one is the antihelminthic drug that is preferred in microsporidiosis? Is it albendazole? Is it ivermectin? Is it praziquantel? Because these three are more commonly used, right? So which one do you think? Right, it is A for albendazole. So microsporidiosis, guys, drug of choice is albendazole. And the last disorder for today is migraine. Migraine has been asked many times, guys. The drug of choice are triptans, right? Though if it is a mild migraine, we can do away with NSAIDs, but NSAIDs won't be effective in moderate to severe cases. So moderate to severe cases, we go for triptans. And overall, if they ask you, triptans are the drug of choice. And one important aspect you need to know about triptans is they are vasoconstrictors as well, right? So they should be avoided in any disorder where vasoconstriction can be detrimental for the patients. Like there is a patient who had an attack of MI, history of MI, or a patient who had stroke, or a patient having angina, or a patient having peripheral vascular disease, right? So these are the conditions where you should not use. Whereas prophylaxis of migraine, the drug of choice is a beta blocker like propranolol. Now remember, guys, increasingly, right, nowadays an anti-epileptic is being used in prophylaxis of migraine. So which anti-epileptic is that? That is more commonly used nowadays. Now if you are thinking valproate, then you are wrong. Valproate is not that commonly used. In fact, it is the last resort in migraine because it can cause obesity, hair loss. And can you think of a female who would like these side effects? No, guys, no, nobody likes, right? So the anti-epileptic which is preferred is topiramate nowadays, right, guys? So drug of choice is beta blocker, propranolol. Topiramate can also be used, right? That is commonly used. Right, we have now come to the second part of the PHARMCAST where I discuss one anti-cancer drug, and today we'll discuss two anti-cancer drugs because they are both similar, like azacitidine and decitabine. Now both these drugs, the mechanism of action is important, guys. Both act by demethylation of DNA. That means they remove a methyl group from the DNA. So now let us find out the use. Now if they are removing methyl from DNA, that means I'll be using them in a disorder where DNA is methylated, and that methylation of DNA in those cells, specific cells, will kill those cells in bone marrow. So bone marrow cells dying. Does it ring a bell, guys? Which disorder am I talking about? Think. It is myelodysplasia, right? So what happens in myelodysplasia? There is methylation of DNA that kills the cell, just like alkylating agents, where we attach an alkylating agent. So just like a methyl group would be attached, it will kill the cells. So remove that by giving drugs like azacitidine, decitabine. So these are drugs of choice for myelodysplasia. How do they act? They act by demethylation of DNA. So its mechanism is important. This is what they ask you. How do they act? Drug of choice is always important, as you know. Right, guys. So we have now come to the last part of our Pharmcast where I discuss some of your queries, right? So one query, it has been asked by Nidhi. Nidhi is asked, sir, Q banks, from Q banks, around 220 questions, they come from Q banks according to the claims. And so theoretically speaking, it should be enough if I prepare only with Q bank and not revising my notes, etc. Right? So see, that is one option you can go. In fact, I know some people, they rely completely on Q banks, right? So some students, they rely. And as I say, it differs from person to person, how comfortable you are. Because if you'll ask me, personally, I prefer things which are organized, right? So I'm going in a sequence, right? Mechanism of action, use, side effect, and in a classification. So that makes sense to me. So I'm not comfortable studying haphazardly, right? Question wise. So if you are comfortable, please go with that, because essentially the Q banks, which are nowadays in the online platforms, they cover A to Z. Almost everything is covered in those Q banks. The only thing is, would you be able to retain in the way they are presented in the Q banks? If you can, please go ahead, right? Otherwise, I am a person, I mostly believe in my notes, right? I believe that I can always bank upon my notes. So if you are a different kind of person, you like to solve MCQs, go through the explanation, and you can remember. Usually this works for people who can grasp very fast, right? So if you are from that crop, you can go through that. Second out, guys, it has been asked by, the name is weird, it is Journey Towards PG, right? So that's a fake name. Anyways, Journey Towards PG, I hope you reach your PG. Your doubt is, sir, I am using 3rd edition notes, and I'm also I'm using 3rd edition notes, but I'm feeling I'm missing some content of edition 4. See guys, things for FOMO is fear of missing out. Time for FOMO is gone, right? You should not think about anything. I told you yesterday as well that your only focus now should be to revise everything that you have studied until now. Do not do anything new. That would be counterproductive. Now, if you had asked me, right, 6 months back, then I would have said, okay, fine, you can go and add on some points. But it is not the time now. Just carry on with your 3rd edition notes, and even if you honestly revise those nicely, you'll get a good rank, right? Because see, there are some changes from one edition to other edition, but it depends upon the timing. The timing now is not right to do this thing that you're asking me, right? So forget about it, right? Don't worry about fear of missing out. You cannot read all the textbooks in this world. Can you do that? No, right? So what you need to do is you need to focus on what is at your hands as of now, right? So revise your 3rd edition notes again and again, at least 2 to 3 times before the exam. Bank on your notes. That's going to help you guys. Alright, so this is a long question from Harshit Mohan, right? So so these questions which I'm solving you guys for you guys, I've received these 3 questions in my inbox. So let me tell you something. See, sometimes I miss the questions in my inbox because sometimes I fatigue from social media, because I'm not a very social media friendly person. I use social media only for the academic activities mostly, because you would have seen I don't post much. And sometimes I might miss your messages. So if you want, so that because I cover all your doubts which are asked in the YouTube. So please, if you want to ask me a doubt, and if you want that it is 100% covered, right, ensured, then please go to the YouTube channel, and because I upload these Pharmcast in YouTube channel as well, and comment there, right, so that it will be 100% covered, because sometimes I might miss on your messages. So coming back to the question here, Harshit Mohan, he has asked, so what he has asked, let me see, it's a very long message, so I just need to cut it short. Alright, so he's following an online platform, and he has friends who are doing face-to-face classes, and his friends who are doing face-to-face classes, or face-to-face classes, they've also been converted to online right nowadays. So they're doing basically coaching from some other institutes, and they are getting into his discomfort zone, right? Intimidating him that the classes are better in those institutes, and that is why, right, we will score better as compared to you, and so on. So if you would have gone through my 4th or 5th pharmacast, I narrated a scenario that used to happen to me when I was preparing. I had a friend, right? I had a friend who was also preparing with me, though we didn't used to live together. I was preparing when I was staying in Gautam Nagar, is nearby AIMS, Delhi. And so every evening, like he would come to me, visit, so that how am I preparing? And he would drop 1 or 2 questions, like just to check how am I preparing, and I would not know the answer because they were such weird questions I would have never heard about, like Landau-Kleffner syndrome in epilepsy. Who knows Landau-Kleffner syndrome, right? Until and unless you are doing neurology PG. So such kind of questions he would drop randomly, and as he would study them in Harrison, and I would get into depression because he knows so much I don't know, and that continued throughout the preparation. But anyways, I knew that I didn't have time to go through all those stuffs because the hyperkalemia, HOCM, the frequently repeated topics, they were glaring at me. So at the end of the day, when the exam was over, I realized whatever you used to ask me, not even one question came out of those. So are you getting my point? So these are people who would be distractors. They might be your friends, they might be your co-aspirants, and they would speak about these things that might dent your confidence. And if you are thinking about this particular thing, right, about the institutes, now tell me something. Have you seen ever that all the students who got seat are from one institute? No, they're evenly distributed. They would be from X, Y, Z. They would be from online. They would be from offline. There would be people who have never done coaching as well. They would also go through. Like, so what does it mean? It means it is not the institutes that pass the exam or they get a seat. It is you who get a seat. It does not mean if only I teach pharmacology, you are gonna pass the exam. Any XYZ teacher will teach you pharmacology, who are in the business, they are doing good, and will pass the exam. So it's not in me as a teacher, it's in you who has to pass the exam. Are you getting my point? So it's a myth. It's a myth that if I do coaching from this institute or that institute, you will pass. It's not like that, guys. You have to understand that the key to success lies in you and not in an institute. So no matter where you are doing it, it all depends upon how honestly you are preparing. And see, the honesty begins with believing in that institute, right? So you have to believe, right? You have to believe in the faculties, you have to believe in that platform, that if I do this, this is more than enough and I'm gonna cross. And believe me, guys, wherever you are studied, it does not matter. If you're honest, if you're working hard, and more essentially, if you have a plan, and if you're executing your plan honestly, you'll get there, right? So don't let anybody get into your confidence, especially in these last few months. These are very crucial, guys. Revision is of utmost importance, right? So if you will not revise properly, then it's just equal to not preparing at all, right? So forget about everything, guys. Don't let the naysayers get into your confidence. Wherever you are, whatever institute you are in safe hands, believe me, right? Now, guys, coming to the comments on YouTube, and Hardeep Kumar, he has asked, sir, how to revise my bookmarked MCQs? Have a lot of it. I tend to forget many facts. My notes don't cover many of the info. And so what should I do? See, you need not worry about these facts. As I said, give your majority of time to your notes. So revise your time. So I have 10 hours. I'll revise my notes 7 hours. And I'll dedicate 3 hours for revision of these bookmarked MCQs, and try to do as much as possible, right? Try to. So if you are more bullish on MCQs, you can take 4 hours instead of 3 hours and make your notes 6 hours. But don't worry about that. Even if you're not able to complete all the bookmark MCQs, it does not matter. It does not matter. It's not that a big deal. But if you will not be able to revise your notes completely, that would hamper your result, right? So MCQs from now on, see, I told you guys, MCQs are not being repeated nowadays. The only reason why you need to do MCQs is to learn the art, how MCQs are solved, because many a times you would not know exactly that this A, B, C or D is the answer, right? So you need to hone that, character of solving MCQs by ruling out one option, two option, three option, comparing different options to the question. So that's an art you develop with multiple, solving of questions. So that is the most important aspect of solving questions. Don't think that I'll solve MCQs, they'll be repeated in the exam and I will get through. That used to happen. Let me remind you, that used to happen back in 2000, before 2011 or 12, right? Before 2011, 12, it used to happen, but not now. All right. Moving on to another doubt that was asked by Mrunal. Right, so Mrunal is asking, he has being tested positive for COVID-19 5 days ago, and his schedule is shattered and he's lagging in revision. And all right, so I understood what you're going through, because see, I also went through the same thing, and even I mentioned this in my PHARMCAST, and I specifically mentioned what I did because I missed on a subject because of illness. So what happened is, I had joined a test and discussion, and it was the month of July, and it was heavily raining, right? So it started raining all of a sudden while I was on my way to the TND. So I was full wet. It was physiology TND, I still remember, but I didn't want to miss on it. So I set the 4 hours of TND on wet cloths, right? And you can imagine what happened after that. I got viral fever, and the virus is a damn virus. I had never suffered such a viral infection, right? So I was feeling almost I would die, because I could not even move. I was having so much of weakness and body ache, and I could not study for 15 days, guys. I remember still 15 days I could not study. And what happened in between these 15 days is, there was my pediatrics TND, and I did not have notes of TND. So I had no source to study pediatrics from. So alright, so I was depressed, because I was counting on that TND of peds, and the teacher who was about to take, he was a very good teacher in his field. I knew that, and I was really looking forward to it. So I was depressed for a few days. Then I thought, all right, I could not attend it. I didn't have the notes. I don't have the notes. So what should I do now? So I chalked out a plan. So then what I did is, every day for half an hour to 1 hour, I will solve MCQs of only peds for next 1 month. So next 1 month I did the MCQs. That time we used to have books like Amit Ashish, Mudit Khanna. You guys might not have heard even about those. And while I solved those with explanations, I made my notes from those explanations. So it was my way out. So like, you'll be ill, you'll be having these problems, but that does not matter. You should count yourself out, right? So everyone has some or the other kind of problems which decrease our efficacy, and everything will not be according to your plan in life, guys. It's just the beginning. You will see when you later move into your life, right? When you get married and have kids. So every time you'll plan something, but it happens something, and you have to adjust yourself. So these are the lessons life is giving you, that the road ahead is not smooth. But life is like ECG. Sometimes it is P, Q, R, S, T, right? And at last it will be a flat line. so until then we need to live, right? So Mrunal, don't lose hope. You are ill, and I wish you speedy recovery. And if you are able to study by lying down or sitting or whatever, try to study, cover up as much as possible. If there is something left behind, then the good thing is, nowadays revision videos are available. You can go to the revision videos and try to complete these faster. Another way out is just solve the MCQs. So you have to devise a plan out of it. You cannot just leave a subject. That is not an option in competitive exams, because it is not a screening exam. It is an exam where you are fighting tooth and nail for every bit of an MCQ, right? Every 0.1, 0.2 mark counts here. All right, so coming to the next doubt here. Right, so this student has asked, I've been preparing for NEET 2021. My aim is to get a seat in my state only, but I'm writing INI-CET. Now should I rush and finish one revision for INI-CET and give my best, or solidly have first revision for NEET 2021, which will finish after INI-CET, and if I revise solidly? This is a great question, guys. This is a great question, and I was also through this situation. The reason being, before 20 days before the AIMS exam, in my time, 20 days before, I had barely finished my course, right? I had barely finished my course. And now the question for me was, should I now in these 20 days do one revision haphazardly only for AIMS, or should I make a timetable till the NEET, I did not have NEET, we used to have AIPG, right? So the same thing. So I thought, should I make a revision plan from now onwards till the NEET exam and target NEET, or should I do it for AIMS? Now what I realized is, where are my chances more of getting a seat? Because see, as it is, I wanted pharmacology. It does not matter where would I get it. I had no complaints whatsoever. And so for me, it was that I should not be left without a seat, right? And my chances were more in the NEET exam. So what I did was, I made a plan for NEET, right? And I appeared for AIMS. It's not that I did not appear for AIMS exam. I appeared for it, right? Just to get a feeling of, one, it would be a practice before the NEET, like a match practice. And second, I thought maybe if I could get 50% qualified, then it would be a booster for me for the NEET exam. But unfortunately, I could not qualify even in the AIMS exam. I did not get 50%. And I was depressed for some time because I was hoping for some consolation from the AIMS exam. But then I sat and I realized that I had not even revised even once, right, before the AIMS exam. I had barely finished my course 20 days back. But then I started revising again and again. After first revision, I started qualifying in the grand test, and the last grand test I was somewhere around 400-500 rank in all India. So that is what revision does to you guys. That is why, if you have not revised and you are not performing well in your grand test, what I need to tell you is, do not be harsh on yourself, right? After you complete first and second revision, you will see your fortune will change a lot in the grand test. So to this student, I would like to say, it depends upon you guys. It depends upon you. I had told you my story because how I looked at it, and everybody has to take a decision for yourself, right? So I just gave you an explanation as to what is my thought process, because I told you I am a great strategist. So I make a strategy looking at what I have at my hand and what is my gain and what is my loss, right? All right, so Bimal Kumar is asking, sir, please make a video on the rationale of use of ivermectin in COVID-19. Bimal Kumar, you can search in my YouTube channel. I have made a video of 1 hour covering almost 50 to 60 drugs in COVID-19. That has ivermectin, that has azithromycin, chloroquine, and that has remdesivir, favipiravir, umifenovir. All these drugs in this world I have covered in that 1 hour video. So please go through that video. It would be great for you. Right, and some students, they have asked me to share, say, sir, we would like to hear about your preparation journey in one of your podcasts. See, I am the past, guys. I am the past. You guys are the future. So we should speak about you guys. So I talk about my preparation in bits and pieces when I think it would be useful in your guidance. Like, it would be more practical, right? It would be more practical when I tell you where I was going through and what was the problem I was having, which is similar, because we can correlate, right? We are Indians, and middle class people, they have all similar kind of stories, so we can correlate. So my preparation, there is nothing as such, guys. I was an average student because I never liked to study much. So I was a seasonal academician, right? So when I was a student, I would not study 12 months. I would study, 2 to 3 months only before the exam. So I have studied in my life exam to exam, exam to exam, exam to exam. So that's how all people are different, right? So I'm like that. But the one thing is, whenever you give me a goal, a target, then I would strategize for it, and I would work hard for it, and I would not rest until I get there. Right, guys, so if there is another important aspect from my life in preparation, guys, I'll keep on discussing in bits and pieces, because that is how it is more entertaining. Otherwise, if I'll keep on telling you my life story all the time, it will be boring, right? Alright, guys, so that's all in today's PHARMCAST. If you guys have any such kind of doubts or concerns with your studies, you can always let me know. I'll try to cover in one of my next PHARMCAST. So take care, guys. Bye-bye. All the best. This was Dr. Ranjan with you.